Good morning, friends and subscribers. It's a fine Saturday morning here, and welcome back to my channel. This is our Saturday research review, and as always, I will put the references in the description. We've got 7 articles to talk about today, but as always, it's become traditional on this channel to do some dad jokes before we get into the research. I know. That's how you all feel, but get over it. In any case, these dad jokes come to us from the website fatherly.com. And we're going to do some ones that have to do with animals and other creatures. So let's have a look here at some of these dad jokes. What do you get if you cross an angry sheep with a moody cow? An animal that's in a bad mood. You loved me saying that, didn't you? Why do seagulls fly over the sea? Because if they flew over a bay, they'd be called bagels. I thought that was pretty clever myself. This one is not so good, but take your leave with who's in the White House right now. But what do you call a penguin in the White House? Lost. Surely. And finally, what do you call a kangaroo's lazy Joey? A pouch potato. Pretty bad, I know, pretty bad. Okay, let's get on with the research and do something more serious here. First up is actually an article from 2022 that a subscriber wrote and asked me to comment on, and I hadn't talked about it previously, so let me just bring it up here and we'll talk about it now. This is a study that comes to us out of the Republic of Korea, was published over in Scientific Reports at nature.com, and it's an article that looks at the risk of ADHD in children with amblyopia. Amblyopia is a reduction in perceptual acuity that doesn't have to do with the eye, the way other disorders of vision might. Instead, amblyopia has to do with white matter tracts that course through the frontal lobe and are related to, or even adjacent to, neurons that are controlling motor coordination and development. So no surprise, it's been found that amblyopic children also often have difficulties with motor coordination. And it's often found to be more common in children with neurodevelopmental disabilities. But this study looks specifically at whether there's a risk of ADHD associated with that. After all, it would make sense if there are problems with frontal lobe nerve tracts, as there are in ADHD, and the frontal lobe is, in generally, the motor part of the brain, it's there for action, then it would make sense that if there's disruption in the white matter fibers in the frontal lobe with amblyopia, it might just be linked to ADHD. And that is exactly what this study found. It found that amblyopia had a higher risk of ADHD, about 69% higher risk than in the general population. But this was not found with autism spectrum disorder, ASD. I was quite surprised at that finding. They did find that in fact it was the problems with fine motor skill and coordination that mediated this risk. So in other words, only in the children with amblyopia and fine motor problems were they likely to see the highest risk of these children also having ADHD. Now, so that's a very interesting finding, but let's remember that's a correlation. The authors go on to make the very common mistake that even undergraduates in statistics are told not to do, of interpreting a correlation as a cause. So they go on to suggest that we need to have more attention to fine motor skill development in amblyopic children in order to prevent ADHD. Well, I'm not so sure of that. Just because there's a variable that helps explain a relationship, that doesn't mean that that variable is the cause of that relationship. But nonetheless, a very nice study that I want to thank a subscriber calling to my attention. Next up is a study on the risk of Raynaud Syndrome in people with ADHD taking medication. This was reported over in the journal CNS Drugs. And this is, as it says, a systematic review. It's not a meta-analysis because Raynaud Syndrome is very rare in ADHD, whether you're being treated or not. If you're not familiar with this syndrome, it's a problem with the peripheral vascular system that's characterized by impaired blood perfusion through the vascular system and often manifested with discoloration on the skin, with some pallor, even with a little cyanosis, and other signs, including a sensitivity to feeling cold. So Raynaud syndrome is what this is called. Now, why would this be associated with medication? Because we know that medications, particularly stimulants, have a tendency to constrict blood vessels and blood flow in certain parts of the body. Doesn't do it all the time or with everybody, but the potential is there. So what did this study find? It identified 61 cases where there appeared to be some relationship between medication and Raynaud syndrome. Now, these weren't all able to be validated or verified, and none of these involved randomized controlled studies. So we can't really interpret these as medications cause Raynaud syndrome, but they may be associated with it in some cases. The problem here, of course, is that there might be an association of Raynaud syndrome with ADHD independent of medication. So what the authors found is that in these 61 cases, which by the way is a very low number given that 197 studies were reviewed to identify these cases, but in these rare cases, they found that medications such as methylphenidate and dextroamphetamine, which are stimulants, were more likely to be associated with this complaint as opposed to atomoxetine, where it was even more rare as a reported side effect. Most cases were mild, and they resolved within weeks of discontinuing the medication or reducing the dose or switching to a different medication. But a few cases were quite severe and required surgical intervention. So there does appear to be a very, very small risk of Raynaud syndrome associated with ADHD medication, but even that's not certain due to the uncontrolled nature of the studies that were reviewed here. And certainly no causal relationship can be established. Credit to the authors for actually saying that in their paper. They do argue, however, that given the severity of this rare side effect, clinicians should at least monitor for its possibility in cases that are going on medication, particularly stimulants. So I thought you might want to be aware of that rare side effect. Now, my next study is an investigation on behavioral addictions in adults with ADHD. And this study was just published this month, and it comes to us, let's see, having difficulty identifying the actual journal here for just a moment. It's +1. I should have known. Sorry, it was covered up there. My apologies. So this study is looking at whether or not ADHD is linked to behavioral addictions. Well, duh, we know it is. We've covered that on this channel before. But specifically, it's looking at the relationship between impulsivity, compulsivity, and distress, and any risk for addictive behaviors associated with gambling, internet use, and get this, exercise. That's right. Some people seem to become addicted to exercise. So this was a study that used 137 healthy adults, controls that is, and 110 ADHD adults who were not medicated. Who were medicated, and there were 99 who were not medicated. Apologies for that confusion. What did they find? They found that those with a diagnosis of ADHD reported higher internet addiction and use problems. No surprise, I can't tell you how many times we've talked about that in the last 2 years on this channel about ADHD predisposing to problematic internet use and especially problematic internet gaming. They also found that people with ADHD not on medication were far less likely to exercise. They call it exercise withdrawal. In contrast, the ADHD adults taking medication had an increased likelihood of exercise, including a higher risk for exercise dependency, or if you wish, addiction. So interesting findings there about that. They did not find a higher risk of gambling addiction in people with ADHD. And by the way, I found that in my Milwaukee longitudinal study nearly 15 to 18 years ago. We looked at our kids with ADHD grown up and in adulthood. We didn't see any link between gambling and ADHD. That link was associated primarily with psychopathic traits and conduct problems, but not ADHD. So fascinating study there over in +1. Up next, I thought, was another fascinating review. This one was a study published in the journal Psychophysiology, and it's a meta-analysis and systematic review on the relationship of ADHD to diminished interoceptive accuracy. Interoception is your capacity to be aware of internal physiological states and sensations. So how likely are you to perceive these internal or interoceptive sensations? And the review found that across 17 articles involving 18 studies, so it looks like one article reported 2 separate studies. Nonetheless, they found that across these studies, 5 of them compared people with and without ADHD. 3 of them found that interoception was reduced in ADHD. And 12 of the studies found an association between level of ADHD symptoms and degree of reduction in interoception in the population. So we have studies of ADHD diagnosed individuals finding this, a reduced awareness of bodily sensations. We have findings showing a relationship between severity of ADHD symptoms in the general population and a reduction in interoception. So why might this be the case? Because one of the executive functions involved that is deficient in ADHD is self-awareness. And although we often think of that as awareness of what I'm doing in the environment around me, it also extends to awareness of my internal states and how accurately I perceive them. So now understand, this doesn't mean to say that people with ADHD have less internal sensations than others. It means that they are less perceptive of those internal physiological states. So that could have to do with awareness, not with the actual sensation itself. Nevertheless, I thought a very interesting review over there in Psychophysiology. My next study is going to be one also over in +1, that journal, that's an association between maternal tobacco smoking during pregnancy and risk for ADHD. Now, I've talked about this topic before on the channel, and we've had other reviews before, and this is yet another review and a meta-analysis, and it finds that out of 55 studies involving more than 4 million participants that were analyzed in the meta-analysis, they found, yes, there was a higher risk of ADHD in the offspring of women who smoked, about a 70% higher risk. Sounds like a lot, doesn't it? But whoa, viewers of this channel know there is a massive mistake that is made in this review. And by the way, other reviews have found that mistake to be true. Here's the mistake. they didn't control for ADHD in the mother. Mothers with ADHD smoke more, and they smoke more during their pregnancy. And if you control for the genetic risk of ADHD posed by the mother having ADHD, there is no relationship of smoking to risk of ADHD in their children. So isn't that interesting? Smoking, as it turns out, seems to be a marker for mothers who have ADHD and who smoke during their pregnancy. But this review doesn't even look at the genetic relationship, goes on to interpret this correlation as a cause and encourages the efforts to reduce smoking in women during their pregnancy. Now, that's probably a good thing to do anyway, but let's not get on our high horse and recommend that based on this correlation of maternal smoking with ADHD when we've seen in other better genetically informed studies that smoking wasn't the cause at all. Okay, so I've covered that before, but I wanted to cover it again because people keep making these mistakes. I mean, I am just stunned that colleagues, that is fellow scientists, continue to interpret correlations this way. It really is an undergraduate's mistake and is taught in undergraduate statistics. But nonetheless, people want to reach for relevance and find something important in their study. So they interpret correlations as causes. Next up, very quickly, I'm not going to talk about it to any great extent, it's yet another meta-analysis of neurofeedback as a treatment for ADHD. Now, I covered this 2 months ago in December when a meta-analysis was published in the same journal as this one, which is the Journal of the American Medical Association. So this review is done by the European ADHD Guidelines Group in their efforts to develop clinical guidelines for practitioners about various topics related to ADHD. Now, what did this study find? It found exactly what the one 2 months ago found. By the way, it's not a study, excuse me, it's a meta-analysis. This study looked at 38 randomized controlled trials and found that if you looked at those in which the reports about ADHD were blinded, that is, people didn't know who was getting the real treatment and who was getting the placebo treatment, they found no significant effects, no significant improvement in ADHD symptoms from neurofeedback. That's exactly what the review found 2 months ago, and this one found the same thing. They do report that there was a small effect of neurofeedback in a subset of randomized controlled trials that used a standard protocol for their intervention. There are about 9 such studies out of these 38 that did that. But otherwise, no significant effect. And the authors go on to report that overall, neurofeedback did not appear to meaningfully benefit individuals with ADHD. So there you go, replication in science. Got to love it, including in a subsequent review of this topic. Now, my final study, which I'm also not going to spend too much time on, but I thought you might want to know about it, and that is a study on intimate partner violence and ADHD that was published over in the journal Scientific Reports over at the website nature.com. Now, for background, about 8 or 9 years ago, there was a huge study using a large sample in the United Kingdom. In fact, it was a population-wide study, as I recall, that looked at this link between ADHD and intimate partner violence and found that ADHD was the best predictor of such violence in the population, and that if there was also drug or alcohol use, and in addition, conduct problems and psychopathic traits, that further increased the likelihood of being involved in intimate partner violence. And by the way, that study found that people with ADHD had a higher risk of both being the victim of such violence and also being the perpetrator. So up comes another study. This is a small study that looked at 131 individuals with and without ADHD. So that's the group that had ADHD. They had 185 without ADHD. These individuals completed an internet-based survey, and what they found is, yet again, degree of ADHD was linked to an increase in both being a victim and also a perpetrator of intimate partner violence when compared to the healthy control group. What's interesting in this paper is that they found that ADHD was a risk factor over and above age and sex. We know that both of those are related to the likelihood of an individual experiencing intimate partner violence. This shows that ADHD is yet another variable. So very similar to the population-wide study out of the UK from about 8 or 9 years ago. Okay, I don't want to spend any more time on your Saturday morning here, so I hope you enjoyed this research review. I certainly did. Boy, we had a lot of articles out this week. I could have reviewed at least 3 or 4 more, but time is of the essence for you guys, so I wanted to make sure that I didn't take too much of your Saturday morning. Hope you enjoyed the review here, and as always, live well, be well, and take care. I know, you're getting sick of that salutation, but I just have to use it because I love it. Thanks for joining me this morning, everybody. Be well.